Hello everyone, my name is Dado, a first year BS Nursing. So today I am going to perform a complete bed bath. But first we are going to discuss its objectives. First, to induce sleep, to prevent pressure sore, to remove toxic substances from the body, to make an effective nurse and patient relationship, to give instructions to the patient, to remove unpleasant odors due to perspiration, to relieve fatigue, to prevent contractures by giving exercise, and lastly would be to minimize the skin irritation. Hi ma'am, good morning. What's your name ma'am?
I'm Zina.
Okay, Ma'am Zina. Ma'am Zina, how are you feeling today?
I'm good.
Good to know, ma'am. So, ma'am, I am Nurse Dado, and it is okay for you that I will perform a bed pan and then complete bed bath.
Yes.
Okay, ma'am. Thank you. So, we will proceed right away, ma'am. Thank you. Complete bed bath means bathing a patient who is confined to bed and cannot have physical and mental capability of self-bathing. Baths is the act of cleaning the body. Baths are given for therapeutic purposes. Gather all the equipments and materials needed in performing the complete bed bath. Apply proper hygiene in performing the complete bed bath. Identified patient using at least two identifiers to ensure stored patient. Assess environment for safety to ensure patient safety and prevent harm. Before performing the procedure, perform hand hygiene and apply clean gloves to reduce transmission of microorganisms. Instructed patient not to bite down. Inspected integrity of leaves, tape, buccal mucosa, gums, palate, and tongue. It is to avoid trouble happening during procedure. Identified presence of common oral problems. To proper oral care prevents pneumonia. Reviewed medical record assessed for risk and oral hygiene problems to know if there's a problem according while performing the procedure for oral hygiene. Determine patient's oral hygiene practices to know how the patient practiced the oral hygiene. Assess patient's ability to grasp and manipulate toothbrush. To assess patients the right thing to do on the properly used toothbrush. Let your patient lie down. Place bath blanket over patient and remove top sheet while patient held blanket. Place soiled linen in laundry bag. It is to provide warmth and privacy during bath. Removing the patient's gown or pajamas and snap sleeves to remove gown to provide full exposure of body parts during bathing. Removal on affected side if an extremity was injured to allow easier manipulation of grow over body parts. Gown properly if patient had IV line and gown has no snap. It is to for manipulation of IV tubing and container may disrupt the flow rate. if patient was wearing contact lenses, remove if appropriate to prevent accidental injury to the eyes. Wash patient's eyes properly. Use clean area of cloth for each eye. Shock cross on eyelids before attempting removal dried eyes. It is to prevent secretions from entering nasocrinal duet. Keep eyelids closed in absence of blink reflex. Close eye before placing eye patch or shield. Did not tape eyelid. It is to prevent accidental injuries to the eye. Bath blanket from patient's arm closest to you. Place bath towel lengthwise under arm. Bath properly with water and soap. Towel prevents soiling of bed. Raise and supported arm, wash and dried axilla. Apply deodorant if appropriate. To drying prevents excess moisture which can cause skin macration or softening. Move the other side of the bed, repeated steps with other arm. Provide a better access to a patient and helps prevent back strain. Covered patient chest with bath towel. Folded bath blanket down to umbilicus. Bath chest properly. Rinse and dried well. It prevents unnecessary exposure of body parts. Folded bath towel on bed. Place basin on towel. Allowed hand to soak before cleaning the nails. Dried well and repeated on the other side. To soften cuticles and calluses, hands loofens, delicacies beneath nails and enhances feeling of cleanliness. Covered chest and abdomen with bath blanket. Exposed near leg by folding blanket toward midline. Ensured other leg and perineum remain draped. Place towel under leg to prevent unnecessary exposure. Wash leg properly. Assess for signs of redness, swelling, or leg pain to promote circulation and nervous rhythm. Cleanse foot. Make sure to bath between toes. Clean unfilled nail dried feet. Promote circulation and removes return secretion and moisture may be present between toes, predisposing patient to macration and breakdown. Side rail, remove the opposite side, repeated step to wash other leg, applied lotion to both feet and remove towel. It is to promote circulation and venous return. Covered with bath blanket, trace side rail and change bath towel. To decrease both water temperature causes illness. Clean water reduces microorganisms. Wash abdomen. Place bath towel over chest and abdomen. Folded bath blanket down to just above public region. Bath, rinse and dried abdomen. Paid attention to skin folds. Dried well. Dropping prevents unnecessary exposure of body parts. Applied clean gown. Dress affected side. First waited until end of the bath if appropriate to maintain patient warmth and comfort. Cleaning the back of the patient, massage patient back if desired, and after that, applied lotion if needed. It is to promote patient's relaxation and to prevent dry, chapped skin. Filled wash basin with warm water, tested temperature, place basin on floor and on pad, had patients immerse feet to reduce inflammation of skin and promotes local circulation. Adjusted over bed table to low positions, placed over patient's lap to easy access of patient's accidental spills. Filled Hermes basin with warm water, place basin or towel over bed table, testified water temperature. Ensure that warm water softens waves and thicken epidermal cells. Instructed patients to place fingers in basin, place arms in comfortable position. To prolonged positioning causes discomfort to the patients, and to ensure normal anatomical alignment is maintained. Clean under fingernails with plastic applicator stick while fingers are immersed to prevent mastication of tissues. Cleaned around cuticles with soft brush or washcloth to remove, destroy under nails that harbors microorganisms. After doing the procedure, remove emesis basin, dried fingers thoroughly to remove microorganisms. In between toes, use washcloth to remove the microorganism. Dried feet, trimmed nails following step 12 to avoid injuries for patient safety. Patient to comfortable position, left call light in reach to promote safety of the patient. Clean gloves, place waterproof pad under patient's shoulders, neck, and head. Ensures patient safety, unitizes spread of microorganisms, and prevent patient from getting wet contaminated. Place shampoo board under patient's head and wash basin under end of spout. Ensured spout extends beyond edge of mattress. Avoid water spillage during shampooing and to catch the shampoo and water. Place towel under patient's neck and bath serve over patient's shoulders to provide comfort and protection. Rinse hair with water. Ensured water drained into basin. Repeated rinsing until free to soap to prevent dandruffs and grumpy. Dried patient's hair and scalp. Use second towel if necessary. Hair to remove tangles and dried hair with a dryer if desired to prevent hair breakage and hair fall. Tights with bath towels, raise blanket to expose genitalia, raise panties, place bath towel underneath, retracted foreskin if present, deferred procedure if patient had an accretion. Dropping minimizes patient anxiety. Wash tip of patient first, cleanse outwards, discarded washcloth, repeated until penis was clean, rinse and dried thoroughly. Direction of cleaning moves from one less contamination to area of most contamination, preventing microorganism. Return foreskin to its natural position. Avoid local edema and discomfort. Folded bath blanket over patient's perineum assisted patient to comfortable position. It is to maintain patient's comfort and safety. Orb hand hygiene, applied clean gloves, place basin of warm water and cleansing solution on overbed table to produces transmission of microorganism. Assisted patient in assuming proper position, noted restrictions in patient positioning, place waterproof pad under patient buttocks, provide full exposure of female genitalia, drop patient appropriately with bath blanket to expose specific location for perineal care. Folded outer corners of blanket around patient tights, lifted lower tip blanket to expose perineum, to minimize the patient's anxiety. Washed and dried patient's upper tights, reduces chances of transmitting microorganism in the urinary meatus. Labia majora, retracted labia from tight and non-dominant hand. Use dominant hand to wash skin folds. Wipe front to back, repeated on opposite side with separate section of washcloth. Rinse and dried area thoroughly. It also reduces chance of transmitting fecal organism to urinary meatus. Separated labia, wash urethral meatus and vaginal orifice front to back. Use separate section of cloth for each stroke. Avoided tension on indwelling catheter if present. It is to reduce chance of transmitting focal organism to urinary meatus. Rinse and dry thoroughly. Use front to back method. Remove soap and microorganism more effective than wiping. Poured warm water over perineal area and dried thoroughly if patient uses a bedpan. It is to remove microorganism and promote moisture.